If you are struggling with pain in the front part of your pelvis, known as SPD or pubic symphysis dysfunction, this workout is going to help you release some tension that may be causing that pain, in addition to helping you strengthen so that we can relieve and have a pain-free pregnancy or postpartum experience. In this workout, we're going to start with some warm-up exercises to help you target the musculature that support this front pelvic joint to help release some tension, in addition to helping those muscles turn on in the way that they're supposed to. We're then going to progress into a workout that is going to be helping you do single leg movements like stepping up or down from stairs, in addition to lunges and walking. And we're going to integrate some movements to help this feel much more accessible to you so that you can have some tools to apply to your daily life and to your workouts. And then we're going to finish with some mobility to cool down to, again, target some uneven tension to make it easier for your pubic symphysis joint to stabilize and for you to be more comfortable throughout this entire journey. Welcome to the MamasteFit YouTube channel. My name is Gina. I'm a perinatal fitness trainer and birth doula, and in this workout, we're going to be targeting the pubic symphysis joint and helping to improve stability of it so that you can have a pain-free experience. The pubic symphysis joint is this front pelvic joint here, and during pregnancy, there are two things that can happen that may cause this joint to be a little bit painful for you. The first is going to be the pelvic position. So for a lot of us during pregnancy, the right half of the pelvis shifts more backwards as the left half shifts more forward. And so this is a common postural tendency that happens throughout all of our lives, but it can become a little bit more exaggerated during pregnancy thanks to the hormone relaxin. So because this pelvic half is sitting back and the left half is sitting forward, it's causing a bit of a torque here in the front part of the pelvis. Certain muscles may be turning off, maybe over lengthened, or maybe even a little bit tight. And so we're going to address this pelvic position in our workout today so that you can find a more neutral position and go into the opposite position so that you can be more pain-free during your pregnancy and into your postpartum. The second thing that may be contributing towards this pubic symphysis pain is the muscles that are attaching and kind of crossing this pubic symphysis may not be coordinated well with one another. And so we're going to be incorporating muscles that target the anterior oblique sling, which is going to be your chest musculature crossing into your obliques. It crosses in front of this pubic symphysis into your opposite inner thigh. So we have this diagonal sling across the front side of our body that helps to stabilize this pubic symphysis joint. We're also going to be targeting the lateral sling, which is going to be your glute musculature, and it wraps around the pubic symphysis into that inner thigh musculature, and this helps with single leg stability. So it's going to be a key player when it comes to moving and walking and doing a lot of those one-sided movements so that, again, we can be pain-free throughout pregnancy. Before we dive into the workout, hit the button to subscribe so that you get notified whenever we release new videos. We release new workouts every Tuesday on our YouTube channel, in addition to tons of educational videos throughout the week. For today's warm-up, we're just going to need a soft object like a Pilates ball, a yoga block. You can use like a soft pillow and a seat. And once you grab those items, let's go ahead and sit down and get started with our warm-up to support our pelvic position. So we're going to start in a seated position and take your soft object and place it between your thighs. And now it can be, I have a Pilates ball here, but you can use like a pillow, a rolled up towel, really anything that you can just kind of squeeze between the legs. We're going to start with the feet parallel, and then I want you to find a comfortable position. So we're not arching a ton in the back. We're not super slouched here. We're just in a more neutral position. If you need, you can place something underneath the back part of your butt to help you come into that neutral position as well. So starting here, I'm going to focus on just my diaphragmatic breathing. So learning how to move my diaphragm with my pelvic floor so that I can integrate this entire core canister system to help with stabilization. So putting your hands onto your rib cage, we're going to think first breathe into our hands, and then exhale, just release. Big inhale into the hands. Exhale, just let go. And now with this inhale, I want you to think breathe into the back as well. So we're breathing into the sides and into the back. So you might find a little bit of rounding in the upper back, and then exhale, just let go. Big inhale into the hands. Exhale, let go. One more with just the exhale to relax. And then release. So now we're going to breathe into the hands, into the back, and then I'm going to exhale to squeeze the ball and pull belly to spine. So big breath into the hands. Exhale, squeeze the ball, lift up. Breathe into the hands. Exhale, squeeze. And then just continue to do a few more breaths here. So breathe into the hands and then exhale, squeeze to lift up. So we're focusing on the inhales. The diaphragm is moving down. We're finding expansion. And then exhales, we're kind of lifting up and in with this muscular activation. So now we're going to find a hip shifted position. So I'm going to drive my left knee forward and I'm going to drive my right knee back. So if you recall, typically the right hip sits more backwards and the left hip sits more forward. And so this position that we're in right now with the right hip more back and the left hip more forward should feel familiar to you. And now that I'm in this normal position for me, I'm going to think inhale into my hands, upper body is kind of twisted towards that right leg. And then exhale, squeeze that ball. Big inhale. Exhale, squeeze. We'll do 3 more breaths here. So think inhale into the back side of the body. Exhale, squeeze. Think lift up in the front side of the body. 1 more breath. And now we're going to switch sides. So left hip is going to come back as right hip goes more forward. We're going to twist in the torso towards that left side. And now we're bringing the hips into the opposite position. So typically right hip is more forward, left hip is more back. But now we're going to bring the left hip back and right hip is going to come more forward. And this is going to probably be a little bit more challenging. You may feel a little bit of release happening as well. So left hip is back, right hip is forward. I'm going to twist towards that left leg and exhale, squeeze that ball. Inhale to release. One more. So now let's go ahead and we're going to grab onto a long resistance band. If you don't have a resistance band nearby, feel free to just move with your arms as you go. The band is just going to add a little bit of resistance. So I'm going to come into that same hip shifted position. So left knee is back, right knee is forward. I'm going to have the band out in front of me. And so now my left arm is going to row back as I squeeze, as I rotate more to the left side, and really think engaging in those left obliques. So trying to crunch towards that left side. So I'm going to exhale, squeeze, pull that band back to crunch, and I'm anchoring with that right hand forward, and then inhale to come back. For a lot of us, the left obliques and side abs are a little bit weaker compared to the right. So we tend to have a little bit of extension happening or rib flare on this side. And so this exercise is helping you to change the pelvic position and also to strengthen the muscles that are helping to support your upper body position as well. Let's do 2 more. Now go ahead and release the band and that ball, and that concludes our warm-up to help with the pelvic positioning. And so if you recall, that right hip typically sits more backwards as the left hip tends to shift more forward. And so in this warm-up, we were targeting our stabilization system with the deep core with breathing. And then we found a hip shifted position where we brought that right hip more forward and left hip more backwards, which is going to help to support that pelvic position. Then we added in an upper body exercise to really emphasize this positioning so that we can ideally find a more neutral position and be able to shift from side to side more easily. We don't necessarily want to only be in neutral or only find that opposite position. Rather, we want the ability to move freely between all three. So I can bring my right hip back, I could find neutral, and I can bring my left hip back, because more movement tends to be what helps us be pain-free during pregnancy and into the postpartum. So now let's get into some of the single leg exercises so that you can learn how to walk up and down stairs and how to do our lunges, in addition to integrating a myofascial sling exercise to help with that muscular coordination across that pubic symphysis joint. For this pelvic stability workout, we're going to need a step-up surface, so you can use a stool or a box, and we're going to need some long resistance bands. You're going to need 2 of them. One, you're going to need attached up a little bit higher, so if you're using your door frame, over the top of your door frame, and then we're going to need a looped one that's around knee level or ankle level for you to be able to put your leg into for our single leg exercises. So we'll need that step-up surface and 2 resistance bands, one attached high and one attached around the knee level. Once you've got your equipment, let's go ahead and get started with today's pelvic stability workout. So grab onto your long resistance band, and we're going to start with a myofascial sling exercise to target the pubic symphysis joint. So this exercise is going to be the diagonal banded pull down. We're going to come into a half kneeling position with the outside leg forward, inside knee is down, and we're going to reach up towards that point of attachment. Exhale, pull that band down towards the knee, and inhale to go back. As you pull down, I'm going to think exhale to lift up in that pelvic floor, and then I'm going to rotate towards the knee. So we're going to add in that preparation exhale. And then you can almost think like these outer obliques are turning on, and you're really focusing on that as what's crunching to bring you towards that right side. Keep that knee aligned to the ankle so that knee is not flailing out, it's not caving in. Now we're going to switch to the opposite direction. So face in the other way. Outside knee is forward, inside knee is down. Reach up towards that point of attachment. Exhale, pull down towards that knee. Inhale to come forward. Keeping that knee stacked over the ankle. Think exhale, then pull. And so really think about those outer abs as what's pulling you towards that knee. Now let's come to our step-up surface. And now this can be a low surface. It doesn't have to be super high. It can just be like a really small box. I'm going to step up on to the box, and we're going to be focusing on stepping down from the box. So I'm going to put weight into one foot, and the other foot is going to be here. And so from here, we're going to begin to lower down slowly, and I'm going to bring my belly more towards my thigh. So I'm stepping here. I'm seeing that my belly is more towards my thigh. And then as I'm in this more internally close hip position, maybe we can then step up from that box. So we're going to focus on the step down portion. So I'm going to think belly towards that thigh as I lower down. and then exhale to come up to face forward. And so we're really focusing on the step down portion. If this feels like a little bit too much, especially on that pubic symphysis joint, use a lower step. It can just be like 2 to 3 inches. We can also just use a little yoga block. It doesn't have to be super high. So we're just focusing on trying to find that closed hip position as we lower. So ideally, we can begin to go the opposite. So let's switch legs. Place the other foot onto your yoga block, onto your step. Find the level that feels good for you. And then we're going to think lower down, bring belly towards thigh, and then extend in that hip to face forward. So we're going to lower down, belly towards thigh, and then extend to face forward or step up on to that box. So we're lowering down, finding that close hip position. Knee is staying stacked over that ankle. Coming up. And then once you feel like you've got it, we can do a bigger step. So we're lowering down, rotating belly to thigh, and then stepping back up. Lowering down, belly is towards the thigh, and then stepping back up. So we're finding that position that is going to help us stabilize more in the hips. So an internally rotated position is how our hips stabilize and how we maintain that single leg stability. And so this variation is going to be helping you to find that stable position to then push off from as you step up, using the level that feels best for you. Now, another movement that tends to be a little tricky is lunges and single leg movements. And a really helpful thing is to grab onto a band. We're going to place it around the inside of the knee, and we're going to move through 2 variations of this. So first, we're going to start with the feet more parallel towards one another. And then I want you to just step the opposite foot back just a tad. So we're in a staggered position. We're going to inhale to lower down to what feels comfortable, and then exhale to come on up. And so we're using this band to give a little bit of feedback to that inner thigh to help you turn that inner thigh on a little bit more, which really helps with pelvic stability. So we're lowering down and then coming up, lower down and back up. And now let's switch to the other leg. So now I have this band around the inside of the thigh. It's going to help to turn it on a little bit more. Stagger the other foot back just a little. And then inhale, lower down, keeping that knee stacked to the ankle, and exhale to come on up. So this is helping, again, to turn on that adductor, turn on the inner thigh, which attached to the pelvis, to the pelvic floor. It is a key player in pelvic stability. And so if the inner thighs are not turning on quite as much because they're getting elongated, they're stretching more during pregnancy, this can be what is causing some of that discomfort for us. So let's go back to that first exercise, grabbing onto that band. Outside knee is going to step forward. Inside knee is down on the floor. So reaching up towards that point of attachment, we're going to exhale to come across. Inhale to come back. Exhale, lift up in the pelvic floor, pull belly to spine. Pull, inhale to go back up. So we're going to keep the arms somewhat straight. This is going to help you to bring it a little bit more into the core. It increases the length of the lever. So exhale, then rotate. Think outer abs is what's crunching to pull you over, and then keep that knee stacked over that ankle. Let's go ahead and switch sides. So outside knee is forward, inside knee is down. We're going to exhale to prep to rotate. Inhale to release. Exhale. And then inhale to let go. So we're going to exhale, then pull. Try to keep the arms straight. And then we're going to think outer abs. It's what's turning on to help me rotate and twist. Go ahead and release the band, and now we're coming to that step down again. So choosing between your yoga block step, maybe a little bit higher of a step. Maybe we start for like 30 seconds with the yoga block, and then we progress towards the bigger step. So we're going to start at the top. We're going to slowly lower down to find a more closed hip position. So belly's more towards the thigh. Knee is stacked over the ankle, and then exhale to come up. So inhales to lower, exhale to come on up. So we're slowly finding that closed hip position at the bottom, and then exhale to come up. So again, these closed hip positions are how we're stabilizing within our hip. And so when we come to a bigger step, if we can find that bottom position, it's going to decrease the discomfort that we have within the pelvis. It's unreasonable to not do any single leg exercises or movements at all throughout pregnancy if we're having pelvic pain. The reason being is we have to walk. We have to be able to function in our daily lives, but sometimes we have to relearn how to do things so they're less scary for us. Now let's go ahead and switch to the other side. So again, if you want to start with the yoga block, so a smaller step to kind of get it, and then come to the bigger step, that's a great option. So go ahead and lower down, finding that closed hip position, and then step up. So we're lowering down, finding the closed hip, so belly's coming more towards that thigh. Knee is stacked over the ankle, and then exhale to come on up. Once you feel like you got it with a little step, your little yoga block, then we can come to the big step. So we're finding that closed hip position, step up, and then slowly lower down to find it again. So step up, slowly lower down, step up. So the slow lower is bringing you into the position that we need to be in to stabilize. And then we can step up from there. So we don't want to be afraid to do movements or anticipate those movements to where we begin to clench, because that can sometimes cause some of the pain as well. Let's go ahead and place those blocks to the side, and let's finish up with one more of the staggered stand squat with that band around that inner thigh. And so you can eventually progress this towards like lunges, so like reverse lunges, split squat as well. So band is around the inside of the thigh, stagger that foot back, inhale, lower down, exhale, come on up. Inhale, lower down, exhale, come on up. You can also think about the pelvic position. So is that left hip or inner hip shifted more forward? Can we bring it more neutral? Can we drive it back to then do our little squat? And you don't have to go super low. You can do like a little quarter squat. If you want, you could add more depth. Let's go ahead and switch sides. Placing that band around the inner thigh, and then again, stagger that foot back. Think about the pelvic position. So are the hips somewhat neutral to one another? Maybe that one hip is a little bit more back. Inhale, lower down, exhale, come on up. So that band is just giving some activation to that inner thigh. Go ahead and release the band. And if you liked this workout and you want either more of a regression or more progression, check out our pelvic stability program, where we have on-demand videos like this, which give you the regressions and the progressions so that you can be pain-free throughout your pregnancy and in your postpartum, because pain is not a requirement of pregnancy. It is not a requirement of motherhood. And if anybody tells you that you need to wait till birth in order to find pain relief, they're lying to you. There's so much that we can do during pregnancy. And we have done a ton with our clients online, in person, so that they can have a pain-free experience. So if you want to check that out, check out our pelvic stability program. We also incorporate a lot of pelvic stability exercises within our prenatal fitness programs. We have those on demand like these videos. We have them self-paced within an app as well. So you can check all of those out on our website at MamasteFit.com and use code YouTube10 to get 10% off any of our online offerings. Within our pelvic stability program, we also incorporate more warm-ups and cool-downs to help you be more comfortable throughout your pregnancy and your postpartum experience. And so if you want more from a workout like this, be sure to check out that online program.